Welcome to my presentation today. I am going to talk about continued professional development and my job role in the industry. I'm going to start by talking about what continued professional development is. Continued professional development is acquiring and improving the knowledge and skills that's necessary for healthcare professionals to offer high quality care and stay up to date with industry changes. Continued professional development is very essential for healthcare workers to keep them aware, adaptable, and capable for patients' expectations. Continued professional development is also a plan to create strategy that is situated to choosing health and social care industry. There are different ways of doing this by attending to training sections, seminars, doing research, conference, and academic. These are examples of self-directed learning and activities. In this presentation, I will examine the significance of continued professional development in the health and social care sector and my job role in this sector, and also emphasize the importance in maintaining competence and delivering high quality treatment. I will also go through various continued professional development related subjects, including continuing education, skills development, and staying current with medical development. Finally, I will discuss my continuing professional development efforts, emphasizing their importance for improving patient outcome and professional growth. In LO1, I am going to talk about my job role in the Children's Hospital. I work in a children's hospital in Nottingham and as a clinical worker. As a clinical worker, it is so important to adapt to changing needs of the industry and also of the patients. One way to do so is by improving personal practice development, also by improving to provide the best care to patients, taking into consideration their preferences, values, and goals. It encourages healthcare workers to enhance their skills and knowledge continuously. In addition, patients obtain better outcomes. They are happier and the health system is more efficient and effective. It also enhances practice improves childcare coordination by encouraging providers, collaboration, and communication. A variety of criteria are considered while planning continued professional development for a children's hospital. First of all, the special needs of young patients are taken into consideration. It requires different methods to enhance their treatment experience. It requires understanding their specific needs and requirements. And the last phase is to look at measures to enhance opportunities to engage in activities that benefit society and public health. Children's Hospital provides several opportunities for continued professional development learning. Activities, interaction with patients and colleagues may assist healthcare professionals to learn and gain experience, and also on-the-job training, workshop, online webinars, develop knowledge and abilities. Participating in research activities and volunteering work for community health initiatives may also help with development. Online courses are helpful, computer-based learning. By participating in various healthcare activities, Children's Hospital may consistently improve their practice and stay up to date with newest advancements and meet the expectation of patients and healthcare industry. In LO2, I am going to talk about GIBS reflective cycle and how I have progressed in my organization and how I've reflected in where I was and where I am now, and how I've helped service users and improved myself. In this sector I work for, communication skills is critical to sustain children's well-being and safety. I have had some time that I had to reflect on my communication skills and how I can improve to get better outcome. I have had some instances where I reflected and identified area for improvement and adjustment. For example, giving handovers. It is a critical moment as you need to share information, sometimes very critical information about patients. You need to be very careful and precise in order for other workers to continue appropriate treatment. Another instance I've experienced is a prescription error during a busy shift. This was a significant moment for me. I administered the improper dosage of medication to a patient. I immediately recognized my error, informed a senior nurse and member staff as we took measures for the patient's safety and well-being. After the incident, I felt different kind of emotions. I felt guilt, I felt concern. I am going to use Gibbs reflective cycle to elaborate my feelings and analyze my reflection. Gibbs reflective cycle is divided into 5 parts. It starts with description, then feelings, evaluation, analysis, and action plan. The description is that I gave the patient the wrong quantity of medication due to a busy moment and my concentration wasn't great at that time. I felt so concerned of the patient's well-being and safety. I evaluated, and this demonstrated the need to pay attention to double-check medication quantity to avoid errors. It also emphasized the need of effective communication among staff members. After analyzing the situation and after a very long thinking and thought, I concluded that the hectic moment and distraction during the busy shift were to blame for the incident. It reminded us, me and my other staff member, the need to be calm and collected to deliver safe patient care, even under pressure. I concluded realizing that mistakes can occur anytime, even with care and attention. It underlined the need of responsibility and ongoing education to prevent same errors. My action plan to prevent future medical errors is that I will always double check medications and quantity of medications, and I will always eliminate any distraction around me and getting myself more informed. I also want to improve my professional development to manage administering medication. I've learned much from my prescription error by doing a critical incident analysis using GAPE reflective cycle. Because of the reflective practice, I learned from my experience, identified improvement areas, and designed an action plan to enhance patient safety and my professional practice. In LO4, I'm going to talk about what I've progressed and developed using my employability skills like communication, with a scenario in my sector. Also, how I have grown and what I've learned to prevent future errors, and how to respond to patients with compassion and good behavior. In the children's hospital, healthcare workers need to contribute to personal growth and important skills that reflect on compassion, values, and behavior to improve the level of care provided to young patients that lead to great outcome. Dedication to continuous development is another important employability skills in children's hospital. Professionals should seek opportunities to grow in the field and reflect on their practice. For example, I've tried to improve my communication skills during handovers. I can communicate effectively during handovers now, even in critical situations. Compared to when I started, I wasn't very informative and I wasn't able to articulate my words very well. And also, I wasn't able to disclose important information and data. I focused on a specific handover incident and realized the need of concise and clear communication.